This is a case study about Jay, a 17-year-old male with complaint of right ear pain. He is a swimmer on a swim team. Upon examination of the auditory canal, he has erythema, inflammation with yellow crusty drainage, and his tympanic membrane is intact. He has a temperature of 98.7 degrees. He has been prescribed ear drops that will be administered by a family member. During the assessment, we will collect data from the patient and physical assessment of the ear. Upon inspection, we see redness and yellow crusting. Otoscope view shows that the auditory canal is reddened and has inflammation. The tympanic membrane is pearly and intact. Pain is noted upon palpation of the ear. Let's look at the anatomy of the ear. The ear is composed of three sections: the external ear, middle ear, and inner structures. The external ear includes the pinna, the tragus, auditory canal, and the eardrum. The middle ear consists of the tympanic cavity containing three bones: the malleus, incus, and stapes. The oval window, eustachian tube, and fluid compromise the middle ear and transmit sound vibrations to the inner ear. The inner ear includes the bony and membranous labyrinth that transmits sound waves through the cochlea to the division of the eighth cranial nerve. The semicircular canals and vestibule help maintain balance. Data collection includes health history, subjective data, and objective data. Jay has been diagnosed with otitis externa, most common infection of the outer ear, usually caused by bacteria. The most common bacteria are Pseudomonas, E. coli, and Staphylococcus aureus. Infection is usually due to the prolonged exposure to moisture, which is another name for swimmer's ear. Pathogenesis starts with trauma to the integrity of the skin. Inflammation occurs that leads to itching and eventually occlusion of the ear canal gland. Scratching by the patient leading to further injury, causing epithelial migration and a warm environment, an ideal medium for growth pathogens. Nursing diagnoses are pain and impaired skin integrity. Treatment includes a combination drug of antibiotics and steroids. Nursing practice dictates safety measures to prevent errors, observing 3 checks and rites of medication administration. Before we start, wash hands. Place the patient in the lateral position on the unaffected side and cleanse ear of yellow crusting with a cotton ball moistened in normal saline solution. Warm the drops in your hand for a few minutes. For infants and children under 3, straighten the auditory canal by pulling the cartilage portion of the pinna down and back. For adults as ambulatory, have the patient sit with the head to the side so that the affected ear is upright. The position prevents the drops from escaping the ear. Straighten the auditory canal by pulling the pinna up and back. Hold the dropper in the ear with the tip above the auditory canal. Do not touch the dropper tip or place it directly on the ear. It may become contaminated. Allow the drops to fall on the side of the ear canal. It is uncomfortable for the patient if drops fall directly onto the tympanic membrane. Release the pinna and gently press on the tragus a few times to help move the medication from the canal toward the tympanic membrane. If ordered, loosely place a cotton ball to prevent medication from leaking out. After instilling the drops, have the patient remain in this position for 5 minutes or as directed by the medication instructions. This prevents medication from leaking out. Document the medication on the MAR. Include time, ear site, right or left, and signature. Document evaluation of the procedure to include assessment and patient's response in the nurse's note. Implement a teaching based upon the patient's support systems, cognitive abilities, age, environment, lifestyle, culture, health beliefs, and previous health experiences. Provide a demonstration of the procedure to the designated family member who will be administering the ear drops and provide written instructions. Evaluate a return demonstration from the family member and record the teaching and response on the nurse's note.